Kitty Clinical here with the next video on Biochem. We're going to be talking about DNA repair, both for double strand and single strand. Start with double strand first. Non-homologous end joining brings together two ends of DNA fragments to repair the double-stranded breaks. Homology is not required. Part of the DNA may be lost or translocated. So you'll see a double-strand break, and then you'll get non-homologous end joining, which is basically where they join together. Homologous recombination is the other DNA double-strand repair, which requires two homologous DNA duplexes. A strand from the damaged double-stranded DNA is repaired using a complementary strand from intact homologous double-stranded DNA as a template. And it's defective in breast ovarian cancers with BRCA1 or BRCA2 mutations, and you'll see it in Fanconi anemia as well. Homologous recombination restores duplexes accurately without loss of nucleotides. Because again, if you want to look at a diagram of it, I would just take a minute to look at the difference between non-homologous end joining and homologous recombination. I would also take the time to look at this for the other single-stranded repairs as well. We'll start with nucleotide excision repair, the first portion of the single strands repair. So nucleotide excision repair is when the specific endonucleases remove the oligonucleotides containing the damaged bases. DNA polymerase and ligase fill and reseal the gap, and the repairs are bulky helix distorting lesions such as in pyrimidine dimers. You'll see this mainly in the G1 phase of the cell cycle. We talked about the cell cycle previously. It's the nucleotide excision repair is defective in xeroderma pigmentosum, which is basically an inability to repair DNA pyrimidine dimers caused by UV exposure, and it presents with dry skin, photosensitivity, skin cancer. Base excision repair is when you have base-specific glycosylase removes altered base and creates an AP site or an apurinic or apyrimidinic, and one or more nucleotides are removed by the AP endonuclease, which cleaves 5' end. The AP lyase cleaves the 3' end. DNA polymerase beta fills the gap, and DNA ligase seals it. So this base excision repair occurs throughout the cell cycle, and it's important in the repair of spontaneous or toxic deamination. And the last type of single-strand repair is going to be the mismatch repair. This is when mismatched nucleotides in newly synthesized strands are removed and gap is filled and resealed. This occurs predominantly in the S phase of the cell cycle. It's defective in Lynch syndrome, which is, we don't really like to use the word Lynch syndrome anymore. They like to call it HNPCC, or hereditary non-polyposis colorectal cancer. Folks, back in the days, we used to use all these type of words to describe diseases. Lynch syndrome has carried a negative connotation because of the word lynching. So a lot of people, they prefer to use hereditary non-polyposis colorectal cancer, which is a very long-winded way to say Lynch syndrome. So off-label, if you see people talking about Lynch syndrome, they might simply say Lynch syndrome for the sake of, not for the sake of ease of conversation. And maybe it's not necessarily the most PC thing to say, but it is still a phrase that is often used in medical jargon. Hope you enjoyed this video. We will move on to the next one shortly.